Hello, and welcome to the Princeton Spine and Joint Center podcast. My name is Scott Curtis. I'm the Director of Sports Medicine here for the group. I just had a wonderful conversation with Nicole Cleffi from Robert Wood Johnson Physical Therapy, and the topic of conversation was blood flow restriction physical therapy. We talked about this new form of technology being used in physical therapy, what it is, and certain patients who it's applicable for, and maybe some patients who it's not so great for. We talked about some of the expected outcomes and how it could help patients both post-operatively and for non-operative musculoskeletal issues. So if you have any interest in blood flow restriction physical therapy, I think you'll really enjoy this program. Hello, and welcome to the Princeton Spine and Joint Center podcast. My name is Scott Curtis. I'm the Director of Sports Medicine here for Princeton Spine and Joint Center. I'm joined here today by Nicole Cleffi from Robert Wood Johnson Physical Therapy. And today we're going to be talking about blood flow restriction physical therapy. Nicole, welcome to the podcast, and thanks for joining us.
Great, thank you for having me.
So before we get into blood flow restriction physical therapy, tell the audience a little bit about yourself and your journey through physical therapy and how you got into this.
Sure. So I'm from this area. I grew up in Hamilton. I went to Steinert High School. I guess you could say I've always played sports, so I was always into sports medicine to some degree. We had a sports medicine class in high school, which was great. I went to Arcadia from undergrad, where I studied psychology, not useful now. But then I went to Columbia University, where I got my doctorate of physical therapy.
Cool.
I've always worked in the outpatient setting, sports injuries type of things, and so currently I'm with Robert Wood Johnson.
Awesome. So clearly really well qualified in the sports physical therapy area. How did you get into, and we're going to talk about what this is for the audience in a little bit, but how did you get into blood flow restriction physical therapy?
I've read about it in the research before, and I first experienced it through Owens Recovery Science. Okay. They're a continuing education company that teaches physical therapists or other practitioners on what it is and how to use the device. They actually certify us. So I took that course, I guess, over a year ago.
Okay.
And then our clinic actually bought one of these, and so we were able to actually start using it in the clinic.
So what is blood flow restriction physical therapy?
Yeah, so in its simplest forms, it's the use of a specialized tourniquet, which is this red device right here. We use it around a person's arm or leg to partially restrict the flow of blood to that limb. So I know that sounds really kind of counterintuitive to a lot of people, but not only has it been proven to be safe, but it's really effective at helping muscle to hypertrophy or to grow at a much faster rate.
So for our listeners who are not watching us on with using video right now, the device that we have in front of us is the blood flow restriction device. And basically, to me, it looks like a big blood pressure cuff.
That's right. It's a very expensive blood pressure cuff. But yeah, so there's the tourniquet that goes around the arm, as you would normally expect. And then this blue device here is what controls it. It inflates it or deflates it.
Okay. And so you said that it's counterintuitive, which when I first heard about this, and I heard about this while I was in my training and it was kind of starting to come out, even though it's been around or thought about for several decades, I said this can't make sense because the idea of this is we're restricting blood flow, but you need blood flow, you need oxygen into an injured tissue to help it heal. So why does this work?
Yeah, so let's just talk about in general what it means. So, the idea of blood flow restriction training, we're cutting off blood supply to the limb. What happens is when the muscle is working in a low oxygen state, the body actually releases more growth hormone and some other metabolites that trigger the hypertrophy of the muscle. So we're recruiting more muscle fibers, more motor units. We're actually seeing angiogenesis, which is the formation of new capillaries in the muscle. So over time, again, we're growing it and it's better using the oxygen. Okay. So even though temporarily we're restricting the blood flow, over time we're getting better oxygen consumption.
Yeah, and that's when it kind of clicked on me. Hey, that does make a lot of sense. You're mechanically lowering the oxygen by lowering the blood flow. So these muscles are saying, hey, wait, something's wrong. We have to actually now form new blood vessels, which will stimulate more growth, which will make the muscles bigger, which is what hypertrophy is, right?
Yeah.
Bigger muscles. And that should, in theory, get it stronger. So who does this work? Who's this studied on, first and foremost, and who has this been shown to really benefit?
Sure. I would say most of the studies out there are looking at post-op cases, particularly ACLs or meniscus. But the reality is it could be used on anybody.
Okay.
Athletes, non-athletes, young, old. They're doing more research on arthritis, like lower body arthritis. I would say in our clinic, we're predominantly using it post-op at this point, but we certainly are branching out more. I have a student with me, and we're doing a case study on MS, strengthening with people with neurological conditions. We can use it on tendinopathies, soft tissue injuries. So there's a huge market for this right now in the rehab setting for sure.
So let's say I have a patient who has either hamstring tendinopathy or let's say tennis elbow, which is really kind of an elbow tendinopathy, and I send them to your practice for a physical therapy evaluation, but on one of the modalities I want it to be blood flow restriction.
Great. Yep.
How would you explain it to them for somebody who's never heard about it? How is this going to benefit them? Are you going to be using this with regular physical therapy? And then how do you go about evaluating and treating that patient?
Yeah, so I would tell them, we're still going to do all of our normal things that you would expect from physical therapy. We're still going to do our full evaluation. We're going to see where your strengths and weaknesses are, if you've got some limitations in soft tissue. We're still going to do the hands-on part. We're going to do some soft tissue work, stretching. But chances are, if you're coming to physical therapy, you have some sort of weakness, right? So that's kind of our bottom line here. So we do our hands-on part first. Then we would, apply the blood flow restriction training to help grow any muscle where there's some atrophy. But then they would also do some other exercises afterwards. With the blood flow restriction training, this is the most challenging part of the session, so we do this first.
Okay.
We're doing 4 rounds of a total of 75 repetitions, so we're really bringing muscles to almost exhaustion.
Yeah.
So we don't want to do that at the end after they've done all kinds of crazy plyometric drills.
Yeah, that's a good point. To me, when I think of physical therapy just in general, there's 3 things that for most people I try to see benefits with. One is pain reduction using different modalities, and it's a good way to kind of help with getting your pain under somewhat control. 2 is flexibility and range of motion, and 3 is strength. Clearly, this has been studied and helps with strength training. Does blood flow restriction in any way help with flexibility and range of motion or with pain control?
Definitely pain control.
Okay.
There's some anecdotal accounts out there of the body releasing more natural opioids and cannabinoids into the bloodstream. There was one study I looked at where they were looking at patients with anterior knee pain, and they did some BFR training, just some open-closed chain exercises, and they found a significant decrease in reported pain.
Cool.
And that lasted for up to 45 minutes after the session ended. So certainly not permanent, but that's noteworthy.
Yeah,
I mean,
absolutely.
you can do a whole lot in that 45 minutes. With the whole opioid crisis, with pain meds, anytime we can find something that's non-pharmaceutical, that's huge.
I completely agree, yeah. And I think that's one of the benefits when I was reading about this that I didn't understand. How could this help with pain control if what we're really trying to achieve is hypertrophy and strength training? But it sounds like it certainly can help, at least to some extent, with pain control.
Sure. Yeah.
But I like how you're using this in conjunction with traditional physical therapy.
Absolutely.
Because I think, you can bulk up and strengthen an area that's weakened, but I also think that there's a lot of other things that can really help adjunct to what you're doing or trying to achieve with this.
That's right.
So we tried this out before we did the started filming this podcast, and I got to tell you, you put this on my bicep and had me do a couple bicep curls. My bicep is still sore. Do patients report, any kind of soreness or increased pain after this is done?
No, I mean, it's certainly unpleasant while you're doing it, full disclosure.
Yeah.
It's not the most pleasant experience. The worst, I think, is during that break period, right?
Yeah.
So I think I mentioned before, we're doing 75 reps. We're doing 30 reps with a 30-second break, and then 15, 15, 15, right? But those 30 seconds in between, that's when you're really starting to feel the blood pooling in your arm. You're going to feel some throbbing, maybe some tingling sensations. That's all normal.
Okay.
As soon as we deflate the cuff, that goes away.
Yeah.
Right? So we always try to encourage people, just kind of bear with me. This is all normal. And then immediately afterwards, it's gone.
Yeah.
Everything feels great. I think worst case scenario, you might get some minor bruising just from the pressure of the cuff, but even that we're rarely ever seeing.
Yeah, I was just exaggerating. It's killing me.
No,
It's a good soreness, you know.
Yeah, exactly. You're causing that good soreness feeling, you know, when that you've actually accomplished something.
So, are there any kind of risks or side effects that you should be aware of with this, or in other words, if you know, who is not an ideal candidate for this?
Yeah, that's a good question. So there's a long list of some you know, potential red flags, I guess you will.
Okay.
And so people who have uncontrolled hypertension, maybe if you've got some clotting issues, anything that might affect blood flow already, maybe some diabetes, if you've had a lymph node removed. It's not that we can't do it. We would definitely reach out to the physician first and just make sure that everybody's on board, that everybody's okay with this.
Yeah, and part of the reason why we are doing this and educating not only our patients but our fellow physicians who may not even know this, you know, a lot of, you know, either primary care doctors or other specialists who don't regularly refer for physical therapy with blood flow restriction may not understand the impact that it could have on one's health. So I think it's important that everybody is on the same page from a therapist, a patient, and a practitioner standpoint, because, you know, I'd be a little bit hesitant if you have a history of upper extremity blood clots to really occlude the vessels.
Right.
You know, I think that's probably a patient that I would say no to.
Right, and that's fair, right? I mean, it's not for everybody, let's be honest.
So,
but I will say, I'm just sorry to interrupt you, only because we were talking about clots. One great thing is there's absolutely no evidence that this does cause clots if you don't already have a clotting issue, even after surgery. They actually find that using the BFR and resistive training actually help the body to release natural anticoagulants.
Is that right?
So, so as long as you don't have any history of it, there's really no risk of a clot formation from this.
Okay.
So
yeah, I would think by, you know, causing vaso-occlusion that you would actually have more stasis and it would actually predispose you to blood clots.
Right. One would think, but all the research articles I've looked at, they've all agreed that there's like almost no risk of that.
That's interesting.
So,
wow, that's really cool. So what are some of so we talked about maybe some patients who we should just be a little bit, you know, judicious about using this. Who are some patients that benefit from it, and how do you keep them from kind of sliding back once this is completed?
So I guess the bottom line is anybody can use it. I mean, there's even healthy individuals using it just to supplement their strength training. They're using maybe resistive bands around their arm or leg, which is not necessarily as safe as using a device like this that has a Doppler built into it, where we're constantly monitoring the flow of blood. I would say it's most useful in anybody who can't handle heavy weight training. So clearly someone coming to PT, they've got an injury, or maybe they've got a surgical restriction. Most often, I would say, again, the post-op patients, because we can do a 1 pound weight on a leg raise or a bicep curl and get a really great benefit out of that. You know, once they're able to handle a pretty heavy weight without any pain or restrictions, we will start to transition off. And I guess the goal, like any physical therapy session, our long-term goal is to get you active. You know, so it's, you know, will they revert back? Who knows? But the best we can do is just kind of give them every advantage, you know, building that muscle while we can, you know, and just give them a homework plan to kind of keep going with that. I mean, obviously not with the tourniquet, but just a general strengthening plan to just keep going further.
What's the expected time frame that one should have kind of in the back of their mind? So a lot of patients, and the reason why I want to bring up time frames, a lot of patients get frustrated with physical therapy in general because it takes several weeks, if not months, to see significant, meaningful benefits in pain reduction and strength and flexibility. And so some patients just want that magic pill or that magic injection. Of course, we would all love that. But what I often will tell patients is that we're just getting your pain under control with, you know, the injection or with the medication, but it's really the strength training and, you know, the physical therapy that's going to keep you from needing anything further. Some patients fully accept that and are all, you know, on board with it. Other patients get frustrated. Is there a different expectation in terms of duration and frequency of physical therapy with blood flow restriction compared to regular traditional PT?
Sure. So traditional PT, we always say, you know, at least 4 to 6 weeks for muscle to change. I probably would still tell them the same. there is evidence that it does speed up this process. Everybody's different,
Sure.
So maybe it takes you 4 weeks, maybe it takes me 6 weeks. I still kind of put that same time frame in their head, but also saying by adding this on, we can speed this up from what you might normally.
Okay.
It's hard to put a time frame on anything really, but I think seeing some of the immediate effects right away kind of helps put into perspective that we're getting somewhere, and we are going to make some progress.
Yeah, and that's certainly encouraging to the patient. They, everybody's looking for that quick result.
Yeah.
And I could just, feel already and see that patients who are using this start to see it a little bit sooner rather than,
right.
5 weeks into physical therapy, they're starting to notice it. By the time they hit that 5 week mark, they might even forget what it was like before they started.
That's very true.
And don't remember what their baseline is. We've talked about how this helps with kind of limb specific things, tennis elbow, hamstrings. Could this be used for the spine? Obviously, working at a place called Princeton Spine and Joint
Yes.
Center, we see a lot of
Yes.
back and neck patients. Is this applicable?
So that's a good question. At this point, we don't really have any solid evidence that it does affect the spine. I can say for sure muscles directly above the tourniquet, such as like the rotator cuff, scapular muscles, the glutes, things like that. We definitely are seeing a positive change. Particular spinal, the extensors or the core. Maybe.
Okay.
I guess the answer is maybe.
Yeah.
It certainly doesn't hurt, but without any way to particularly occlude, the neck or
we don't want to occlude the neck.
That's not a great
bad.
idea, but it certainly is worth looking into more.
Yeah.
And I'm waiting for more research to come out on that.
Yeah, and it's I think it's going to be there eventually. Maybe not with this kind of device that only fits around one of the limbs. There might be a back brace that will have some degree of occlusion, but I think it's hard to really address the spine in this fashion. That being said, I have a ton of patients with low back pain who offload the spine and compensate and then develop a trochanteric bursitis or knee problems or foot and ankle issues. Those people might get benefit from addressing the limb issues while also addressing the underlying spinal issues as well.
Absolutely. We always look at the person as a whole.
Exactly.
They're not a back.
Correct.
They're an entire person. So
Correct.
clearly there are other issues.
Yeah.
So I completely agree. I think that would be beneficial.
Yeah. If a patient wants this specifically, is there any kind of things that they should avoid before or after? In other words, some patients are concerned about blood pressure. Should they be taking their blood pressure medication before they use this? Should they take their blood thinners? Should they watch their sugars? What kind of advice do you have for the audience before or after they do this?
Yeah, as far as I know, we tell them to just do everything as they normally would. We are checking with the physician. So if they had any concerns, they would hopefully tell us right up front, have them either not take their blood pressure medicine, but I can't say I've ever had that happen so far.
Yeah.
If anything, afterwards, we might encourage them to have a little bit more protein that day, just to kind of help to compensate for the muscle being worked in this heavy-duty manner.
Yeah.
But even then, as long as they just go about their day as normal, there's really no particular instructions.
From a medical standpoint, I don't see anything that I'd be overly concerned about. The one thing that I would, in theory, be concerned about is by restricting the muscle and working it out is if you have a history of, let's say, rhabdomyolysis, which is basically where the muscle starts to break down because of lack of oxygen. I'd probably just say, maybe this isn't best for you, or if you have kidney problems where you might overload it. But I don't think you're working these individuals out to exhaustion where they're starting to get muscle breakdown because you're working them out so hard.
Right. Yeah, there's... To what we're using it for, there's very little risk of muscle damage. We're using very light weights. Certainly, though, if somebody had a history of that, I would take more caution with it. And again, if the physician told me otherwise, then we would certainly pick another option.
Yeah, that's more so for, I've seen that in a lot of, CrossFit or high-intensity interval training where they're just really destroying their muscles. And I could see somebody being, overzealous and trying to do that kind of training with blood flow restriction. Those are the people who would be on my radar for that.
Those are, when I mentioned, healthy individuals using it with the tourniquets, it scares me a little bit. At least with this, like I said, we have the Doppler in here. We're constantly monitoring.
Yeah.
This device is FDA approved, so we know that it's safe to use other than what somebody randomly is doing in the gym.
Yeah, that makes me a little bit nervous. But I know, professional athletes use this, collegiate, weekend warriors are starting to hear more and more about it and asking about it. So I think it's certainly appropriate to talk about.
Yeah, I mean, I think one of the big things I didn't mention before, the American College of Sports Medicine recommends lifting moderate to heavy weights to make any change.
Sure.
So the fact that we can get that same moderate to high intensity by only, by moderate to high, they say like 65 to 75% of the 1 rep max.
Okay.
We're getting that exact same effect with only 20 to 30% of a 1 rep max. I mean, that's huge. Like, so I could see everybody wanting to.
So in other words, if I'm, lifting at the gym and this is a little bit light for me, but if I do a bicep curl with a 100-pound weight, then what you're saying is when you apply this, I would get that same kind of feeling of lifting a 100-pound weight with a 20 or 30-pound weight.
That's right. Yeah. Yeah, exactly.
That's incredible. And that's why I think it's so applicable, right? Because I have a ton of patients with tennis elbow, for example, or golfer's elbow, who say it hurts them so much to hold up a cup of coffee, right? Which is 2-3 pounds. Right. So to get them into a physical therapy program where we want them to start building up the muscle to kind of regrow things and to start with the healing process, but they're not able to lift anything more than 2 or 3 pounds. They're not going to get that kind of hypertrophy and that kind of muscle building with just doing that. So by restricting the blood flow and actually getting gains and benefits from a 2 or 3 pound weight, and actually speeding up the healing process, I think is a tremendous improvement in the capacity for physical therapy.
Yeah, completely agreed. Yeah. Just to add on to that, I mean, I think just anyone who's even just deconditioned, someone who hasn't been doing any exercise and, a 2-pound weight is heavy for them. Even if we just do just a bicep curl without any weight, they're lifting the weight of their arm. I mean, that's just to kind of get them going.
Yeah, we have quite a few patients who just are deconditioned. They were just recently in the hospital, for example, and, their muscles have atrophied. And I think that this would be, when we do physical therapy and they start to feel the initial benefits right away, but then they kind of plateau because they're too afraid, or the therapist is a little bit apprehensive of really increasing the weight in a 90-year-old little old lady who has some atrophy. But I think that this might be a good way to kind of increase the potential gains and potential benefits without increasing the risk of a heavy load.
Agreed. Yeah.
Now, we talked a little bit before we even got started doing the podcast about the application of blood flow restriction with PRP. We've had previous episodes where we discussed PRP, platelet-rich plasma, in a way to kind of stimulate growth cells. How can blood flow restriction help with PRP injections?
So the best thing that I could say about this is there was a couple of studies, and there was actually another podcast directly from Owens Recovery Science that talked about doing a session of BFR about 30 minutes prior. They have some sort of setup where they have a PT clinic and a physician's office kind of in the same building, awesome. Which is pretty cool. Yeah. So they would have them either downstairs, whatever, doing their BFR training, so they're getting that really big pump. They're getting all that release of metabolites, the growth hormones, and I guess what other things that you're looking for specifically in PRP. And they'll send them right upstairs to the doctor, and then they can do the blood draw right on the spot, and they're getting more of those factors that are important that we're, in terms of the red blood cells and whatnot.
Oh, that's awesome.
So, can't say I've had any personal experience with that, but that might be something cool we could try sometime down the road.
Yeah, I think that would be a great way to kind of use a little bit of column A and a little bit of column B to make something really, really impactful. With PRP, the study suggests that the more growth factors, the more you have, the more likely it's going to help with the healing process. And of course, the studies are mixed on everything. But I think it's a non-invasive way to try to increase the odds of PRP working for patients who otherwise don't really have many other options. That's when I find it most applicable. So I think that this is a great way to kind of enhance physical therapy to help patients who may not be able to do as much of a load. And I think it's a great way to really just overall help our patients that we want to see better. Yeah,
just something new that we can add on if they've had if they were not successful elsewhere. Yeah, it's definitely worth trying.
Is there anything else you think our listeners and our viewers might want to know about this that we maybe didn't talk about?
No, I mean, I think that the big thing that people always ask, is it painful? I think everybody's always worried about that first session, what it's going to feel like. And, I guess as long as you know in your head that, yes, it is going to be uncomfortable, but we are going to see some significant changes with it, you can kind of push through it and just bear with us, and it'll be worth your while.
Yeah, and the computer kind of senses when... So when I was doing it before we started recording, it basically measures your own personal occlusion, right? How much pressure it takes to fully occlude it.
Yes, exactly.
And then it tailors that to you, your individual.
Yeah, I can talk about that a little bit more, actually. So prior to starting each BFR session, we have to take a baseline, just kind of walk you through what a session would be like. We turn on the device, it pumps up the tourniquet until it completely blocks the flow of blood to your limb, like you mentioned. So that's actually called the limb occlusion pressure. Okay. And it's different for everybody. So as you saw, your number was pretty high. It's not your actual blood pressure. It's just it's the amount of pressure that it takes to completely occlude the artery in that arm, in the arm or leg. Depending on the size of your arm, if there's more fatty tissue, muscle tissue, it's going to be a little bit different. So, but once we get that limb occlusion pressure, that's where we back it off. And we back it off to a certain percentage. If we're looking at the arm, we're going to back it off to 50%. So meaning 50% of the blood can get into the arm, but venous return is completely blocked. And then it would be 80% for the leg. Okay. And those numbers aren't necessarily set in stone. The higher the percentage, the more challenging the exercise is going to be. But that's just what studies show is most effective.
Right. So, and I think that's certainly reassuring for an individual patient who might be concerned that this is going to hurt. Well, the machine is kind of tailoring it to you.
Yes.
So what the occlusion pressure is going to be for somebody like myself is not going to be the same for that 90-year-old woman with weakness. It's not going to be the same for that 20-year-old with an ACL reconstructive surgery. So it is certainly individualized, which I think is helpful for the patient to feel a little bit more confident with it. And hopefully less pain.
Yeah, absolutely.
So I just want to thank you again for joining us today to talk about blood flow restriction physical therapy.
This was great.
I think it was really eye-opening for myself and hopefully for the audience. And I just want to thank the viewers and listeners for sticking with us, and hope you enjoyed it.